Assalamu alaikum. هذا Mr. Henry Kutcher. Mr. Kutcher is 93 years old, gentleman, and he has atrial fibrillation since 1961. Is that right?
Sometimes in there, yes.
Yes.
That's right.
Then he has been in warfarin for a long time, but his doctor decided to switch him to the oral anticoagulants when the first one was a Pradaxa, came to the market in 2009, around that time.
Around that time, that's right.
So there was, of course, there was an error of judgment. So Mr. Kutcher will share the experience with us. So can you tell us what happened?
Well, I got a blood clot.
After how long?
I took 5 days off the
Pradaxa.
yeah.
Yes.
And then I got a blood clot. So I
Right there. Right away.
Right away.
In your arm, yes. Okay. Now, which one you take, the 150 or the 110?
I couldn't tell you.
You couldn't
I can't
remember. You can't remember. That's fine. Now, then they treated you back and like with heparin and warfarin again, right?
That's right.
Yeah.
I had to give my own heparin myself.
Oh, yeah. For how long? 6 weeks?
No, 10 days.
10 days only. Okay. Yeah. Then they switched you back in warfarin, right?
I was switched on warfarin. That's
Okay.
right.
And now here's the thing. You know what happened? There are different types of atrial fibrillation or different causes of atrial fibrillation. Now, atrial fibrillation could be related to high blood pressure, could be related to thyroid problems, could be related to a few other issues. But when it's related to valve issues, right, we call it valvular atrial fibrillation. Now, when it comes to classification, we classify atrial fibrillation to valvular or non-valvular, okay? Because management is totally different. If you have valvular atrial fibrillation, then you have to be in warfarin. The other guys is not gonna work. They're not gonna work. You ended up having blood clot. Like that's exactly what happened to you.
That's what happened.
Absolutely. Now, we're not gonna like judge anyone. It's just an error of judgment. The doctor thought that would be beneficial for you, right?
That's
you didn't
right.
have to do the blood work and all that stuff, right? Because
That's
when
right.
the new anticoagulants came to the market, we were all excited about it. We didn't have to monitor INRs and call patient every day and tell them stay in the same dosage and you know that headache.
We went through that.
Absolutely, the INRs. So then the recommendations came that these new anticoagulants, they never been tested on valvular atrial fibrillations because the drug company, they're not going to take that risk. By switching you to the oral anticoagulants, guarantee you're going to have blood clots. So they cannot run a study of 60,000 patients knowing that most of them, they ended up having blood clots. It was just too risky. So when they discussed the option of giving the oral anticoagulants, the new ones, that they don't need monitoring with INRs, they talk about non-valvular atrial fibrillation. All right, so there are few of them. There's Xarelto, like the one here, that's Xarelto. Now, Pradaxa came to the market, the first one, then Xarelto, then Eliquis, and Lixiana. So there are 4 that I'm aware of. Now, with the Pradaxa, even though it was the first time, there was some controversy around that medication. They said that the drug company hid some information about the side effects and kind of like manipulated the results a little bit. So that's why it's not popular anymore. I do remember the last time I've seen Pradaxa and the drug company, they don't send us samples anymore because I hardly use them. And I told their representative one time, the pharmaceutical rep, I told him one time, I told him there was some controversy about your results, guys. Of course, he denied and he sent me some stuff, but I just basically, I'm not gonna put patients at risk right, with the products. So right now what I'm using is either Xarelto, this one, or Aliquis, or sometimes Lixiana. It's not that popular, but Aliquis and Xarelto are the most popular ones and the ones that I use most, and they're easy to monitor. But yet, still, they're not indicated for people who have valvular atrial fibrillation. That's what happened with your case.
So I'm not eligible for that stuff.
No, you have been in warfare forever. You're gonna be forever. That's, you know.
I'm a good rat.
Absolutely, it's not gonna change. Okay. Yes. All right, sir. Thank you so much.
Thank you.
Okay, take care. Bye bye.